The objects in this room represent much of the history of American flight. A lot of my life is represented here, too. July 1969, we landed on the moon. It doesn't seem so long ago now, but the space program is behind me now. A lot has happened since then. My life has certainly changed. When you're used to having most things go right, it's difficult suddenly to face anything going wrong. But that's what happened. My life began to come apart. Depression, something I thought only happened to other people, was happening to me. I had become part of that 1 in 10 Americans who was mentally ill. I thought I'd made some tough decisions in my life, but now I was facing one which was probably my biggest: the decision to seek professional help for an emotional problem. All of my education, my military training, my flight training, all of my training as an astronaut couldn't help me now. I had to reach out to someone else for help. I was afraid of the stigma, what it would do to my career. But I knew I needed help, and I knew it wasn't going to be easy. There is no overnight cure. After getting help, I made another decision. I made up my mind that I would share my experience for whatever good it might do for somebody else. I had learned the lesson that nobody is too big to seek professional help. Hiding an emotional problem, I realized, was like returning to the Dark Ages. And I don't think we can watch men walk on the moon and be in the Dark Ages. In 1972, I learned something about the Mental Health Association and wanted to know a lot more. But I had decided to write a book about my experience, and that really takes time. However, I spent as much time as I could learning about the activities of this citizens organization. How exciting it was to find out that this group was working for and saying the same things I wanted to say about mental health. At the Detroit annual meeting, I was asked to serve on the national board. And a year later, greatly honored to be asked to serve as your national mental health chairman. In this role, I'm learning even more about the association's work. The activities of the many chapters all across the country. I wish I could personally visit each and every one of your communities. Unfortunately, that won't be possible. But maybe I can use this opportunity to share some of my enthusiasm with you, some of my pride in being a part of the Mental Health Association. Whenever anyone asks me what the association does, I find the answer is easy when I just think about the past year alone. We made quite an impact. Let me share with you some moments from a recent briefing I attended concerning the highlights of 1973.
What I've been covering up to now deals with some of the exciting advances in divisions and chapters. But let me move now to some of the magnificent events which have made the year easily the most successful one in the 65 years of the association's history. It's been a remarkable period, and frankly, I hope that you will accept a responsibility to carry this word back so that every volunteer in the association recognizes that he or she is part of an operation that is really making a tremendous difference. Let me run down this list of 11 items very quickly and then come back and provide some more detail. Number one was renewal of the Community Mental Health Centers Act. The priority job, and one we recognized a year ago, might not be possible. But gloriously, it's happened. And if we hadn't succeeded, the whole Community Mental Health Center program would have come to a complete halt. Number two was our participation in the successful court action to require the administration to release $52 million of Community Mental Health Center money voted by Congress and withheld by the administration. Now, very frankly, I think it's encouraging, certainly exciting to recognize that as the result of the suit and the renewal legislation, that in this year, this 1 year, there will be 180 new startups of centers, bringing us 12% closer to the association's primary program goal of bringing about 1,500 comprehensive community mental health systems by the year 1980. Number three, the association was involved in another suit, This one to force the administration to release monies that the Congress had voted and the administration had withheld that were intended for research and alcoholism and manpower programs. The total monies involved in our suit, all of which have now been released, came to $126 million. I find it almost mind-boggling to recognize that in this, just one out of the 11 major events, the association has succeeded in shaking loose $126 million to expand the manpower pool, to increase our capacity to find the answers to mental illness, and to deal with the epidemic of alcoholism. Number 4, the association successfully sued the government to require them to apply the minimum wage laws to patients productively employed in institutions. Victory in this anti-peonage suit will end virtual enslavement for thousands and thousands of mental patients.
It was an exciting year. In addition, the association released its second major public education film, Journey. I've seen this film, and I know how tough that journey can be. But I also know how important it is to make it. Yes, it was an impressive year, and these are just the highlights. But none of these things could have been possible without the participation of each and every one of you. When I look at what we've done in the past, I'm excited about what we can do in the future. Not only in Washington, D.C., but in places like Boston, Harrisburg, Atlanta, St. Petersburg, Chicago, Fort Wayne, Milwaukee, Denver, San Francisco, Los Angeles, and in the hundreds of other cities and towns where mental health volunteers are behind this vital effort. More and more people are learning that this is the organization that really does make a difference for mental health and the mentally ill. And we must constantly remind them that the goals and objectives of the association need public acceptance and financial support. Yes, a lot has happened since July 1969. But technology, which has done so much for our world, hasn't done it all. Ours is an even bigger job: to bring about those important changes in human services. It's a job which needs the best efforts of each one of us. I hope I can meet many of you as I travel around the country. In the meantime, thank you for giving me the opportunity to work with you.